Hello, my name is Christine Hamori, and I'd like to tell you about an upcoming article in the Aesthetic Surgery Journal. An article I wrote together with Daniel Saison as well as Otto Plasik out of Chicago. Basically, we're trying to determine how the public perceives labiaplasty versus another procedure such as breast reduction, where organs related to sexual function were reduced. So basically what we did was a crowdsourcing analysis with mTurk on Amazon, and we queried about 448 women between the ages of about 17 and 61 with an average age of about 32. And a survey was sent to them asking them their opinion as if they were to have a procedure themselves or a friend was having a procedure, either a breast reduction or a labiaplasty. Initially, we asked the questions to see what their thought was on the process. Most of them felt that it was socially unacceptable to have a procedure such as labiaplasty, where it was more acceptable to have a procedure such as breast reduction. After they initially filled out the survey, we sent them a little educational panel educating them about the procedures. Things like perhaps you get rashes if you have large breasts, perhaps you have trouble with your hygiene if you have large labia, perhaps you're embarrassed about your large breasts because they look too large in clothing or nude. Perhaps you're embarrassed about your labia because they're hanging down too low when you're nude, or in the gym you feel bulky. So once they were educated about these issues, the patients retook the test. And it's interesting, still more than half of the respondents felt that the procedure labiaplasty was not socially acceptable, that they would probably not recommend it to a friend having it done because it wasn't socially acceptable. They also felt that it was probably unnecessary, despite having read and been educated about some of the benefits of the procedure. And finally, they thought that it might be related to female genital mutilation. We know this is not true, and it's interesting how the perception of labiaplasty has not changed. The stigma still exists. I hope you enjoy reading it.